Well, thank you for the opportunity to talk with you guys today. This is a topic that we're really passionate about, and we appreciate you giving the chance to talk a little bit about something that we think is a big issue in society today. So I have three objectives for my talk today. I'd like to first define the obesity epidemic that we have in the United States. I'd then like to discuss the complications associated with obesity, and then spend a little bit of time at the end outlining the successes of weight loss surgery and why we really think that it's the one real answer for the obesity epidemic that we have. So I think one of the first things you have to do before you talk about why obesity is important and what we do to fix it is to talk about what it isn't. So obesity isn't just a cosmetic issue. It's not something that happens just because people eat too much, and it's not caused by a lack of self-control. Well, what is obesity? According to the World Health Organization, obesity is a chronic and progressive disease. It's a combination of both genetic and environmental factors, and it's an important public health issue, not just for adults, but also for kids. And like I said, it's a progressive disease. When someone becomes obese, it makes changes within their body that puts them at risk for gaining more weight. And it's a disease that we have to treat individually according to each patient. This isn't a one-size-fits-all the way that we treat this. This is something where you sit down with a patient, you develop a plan of attack, and you go at it that way. So like I said, obesity is something that we need treated as a disease. So broken down very simply, obesity and overweight are defined as an abnormal or excessive accumulation of fat that can impair a patient's health. Well, how do we measure that today? Currently, we use the body mass index. So we take the body mass index, which is an adult's weight in kilograms divided by their height in meters squared. And we break that down and we use that to tell when we would expect people to have the complications related to being overweight or obese. Now, this isn't a perfect tool, but it is the tool that we have today. It doesn't accurately measure fat content when you're talking about the proportion of fat versus lean tissue mass. So if someone's very strong or has a very big frame, they may have a higher BMI despite not being classically obese in appearance. It also doesn't measure where people keep their weight. We know from research what we've seen over time is that when people have more of an apple sort of shape to their body, that they have the complications of obesity at a much lower weight than someone that has more of a pear shape to their abdomen, and the BMI may not accurately reflect those differences. It also doesn't reflect the differences that you can see in race and even sex. We know that Asian populations and some Native American populations are going to experience the complications of obesity at a much lower BMI than you may see in a Caucasian individual. And then lastly, it doesn't address the fact that as many as 25% of Americans are going to have unhealthy metabolic profiles despite having a normal BMI. So when we break down the BMIs, we see that if your BMI is less than 18.5, you'd be considered underweight. A normal weight is going to be anywhere from 18.5 to 25. You start talking about a person being overweight when they're 25 to 30, and then once you get above a BMI of 30, you start talking about obesity, with class 1 being 30 to 35, class 2 being 35 to 40, and class 3 or severe obesity being a BMI of greater than 40. Now, one of the things that I think that it's important for us to acknowledge that this is something that's been coming on relatively recently, which I think is encouraging because it shows us that we have the ability to make a big dent in it as a public health problem. The BRFSS, which is the Behavioral Risk Factor Surveillance Survey, is the longest running telephone survey in the United States. In 1985, they started collecting obesity data or weight data on the population. And you can see early on with the white data that there wasn't a great deal of information from a lot of the states. When you move up to 1990, though, you can see that the obesity rate wasn't that high, with no state having an obesity prevalence greater than 15%. As we move forward, though, you can see that the map becomes darker and the prevalence of obesity increases. Moving up to 2000, there was no state with an obesity prevalence greater than 20%, but there is a significant increase of obesity. Moving up another decade, you can see we're adding new categories, and by 2010, there were 36 states with obesity prevalence greater than 25%, and 12 states with an obesity prevalence greater than 30%. And with the most recent data, you can see that now there are 2 states in the United States with an obesity prevalence greater than 35%. This really is an epidemic that we need to start addressing in our adult population. Now, with that said, this isn't just an adult problem. The obesity rates for children have doubled in the past 30 years. Over that same period, the rates for adolescents have tripled. And this isn't just an epidemic in the United States, it's really an epidemic across the world. Worldwide, there are at least 500 million adults that are obese and another 1.4 billion that are overweight. 42 million children under the age of 5 were obese or overweight in the world in 2013. This is a graph, and what this represents are some of the countries that record their obesity, with a worldwide average of obesity somewhere around 18%, the United States coming down in here around 35%. So this is something that we need to address both on a national and international level. So why do we care about obesity? Why is it something that we as physicians and clinicians worry about so much? Well, number one, there's diabetes. So there's two types of diabetes. There's type 1, or what we used to call juvenile diabetes, where the people lack the ability to make insulin, which is the molecule that helps us control our blood sugars. Type 2, which is 90 to 95% of the cases, happens when your body becomes resistant to that insulin that your body makes. What we know now is that with a BMI greater than 35, the person's risk for developing diabetes is 50 times higher, and obesity is the single best predictor for the development of diabetes type 2. Well, why does that matter? Almost everybody knows someone with diabetes today. Well, diabetes is a significant predictor for bad health complications. It's the number one cause of kidney failure. It's the number one cause of blindness. It's the number one cause of lower extremity amputation outside of a traumatic setting. The risk of stroke or complications from cardiovascular disease is 2 to 4 times higher in people that have diabetes. And when you talk about someone that's diabetic, their life expectancy can go down between 12 and 14 years. Diabetes was the 6th leading cause of death in the United States in 2002 and accounts for over 200,000 deaths each year. Well, what about cardiovascular disease? Heart disease is the leading cause of death for both men and women in the United States. Approximately 700,000 people die from heart disease each year, and obesity is an important risk factor for this. People that are obese are more likely to have high blood pressure and high cholesterol. They're more likely to have congestive heart failure, and they're more likely to have coronary artery disease. And as the obesity increases, the level of someone's obesity, so too does the risk for heart disease. I think this is best illustrated by these two maps. On the right, again, you see this is the 2013 data for the obesity prevalence in the United States. And this is the prevalence of heart disease death rates from 2008 to 2010. And you can see that where it's the darkest red is where we see the most obesity in the United States. This is a significant problem. What about the lungs? Does obesity affect the lungs? And the answer is yes. Approximately 25% of obese people have asthma. Another 50 to 60% are going to have sleep apnea. Now, sleep apnea just doesn't make you tired. It just doesn't make you have daytime drowsiness. It also increases your risk of dying from heart disease and developing heart failure. It increases your blood pressure and it increases your cholesterol. It's a significant health problem. And I think something we're seeing more that's been under-recognized is that obesity does increase the risk of you developing cancer. As early as 2007, there were approximately 34,000 new cases of cancer in men and over 50,000 cases of cancer in women that were attributed to obesity. In 2030, that number is expected to balloon to over 500,000 new cases of cancer. In the United States, as high as 20% of female cancers and 14% of male cancers were directly attributed in part to obesity. That translates to over 100,000 deaths each year. So what cancers are we talking about? Well, colon cancer has increased by 33%. Kidney cancer has increased the risk by over 84%. There's an increased risk of prostate cancer by over 12%, and endometrial cancer by over 152%, and that doesn't even count breast cancer that is obviously a very hormonally responsible cancer. So clearly this is a problem throughout the world. It also has significant health problems that are associated with it. So why are we so passionate about weight loss surgery? Well, the simple answer is because it's effective. And I think the most important thing is that it's a safe surgery. There is an 89% decrease in the risk of dying at 5 years in people who have had weight loss surgery versus a population who did not. There's a 90% decreased risk in dying from diabetes after surgery, a 60% decrease in the risk of dying from cancer after weight loss surgery, and a 50% reduction in the risk of dying from heart disease after surgery. When talking about the safety of the surgery itself, it's no more different than getting your gallbladder out as far as safety or the risk of dying, and it's safer than getting your hip replaced. Ultimately, this operation is safer than doing nothing at all. Well, what about bariatric surgery versus non-operative efforts to treat your medical problems? Well, with bariatric surgery, there's a decreased risk in both the absolute number of heart attacks or strokes, as well as the number of deaths from these events. It results in normalization of cholesterol in up to 80%. Up to 95% of people will see their sleep apnea go away. Bariatric surgery is significantly more likely to prevent the development of and improve the cure rate for type 2 diabetes. It's associated with a significant decrease in new cancers, and perhaps most importantly for a lot of our patients, it produces a significant, tangible improvement in their health-related quality of life. And really the bottom line is that weight loss surgery is going to produce a more reliable and significant impact in the patient's weight when compared to a non-operative effort.